WCNC Charlotte. This is Flashpoint, where power and politics collide and the tough questions get asked and answered.
Thanks for joining us here on Flashpoint. I'm Ben Thompson. 2 years ago this week, Charlotte reported its first case of COVID-19. Since then, it's been a sad, frustrating, and at times maddening time. Nowhere is that more true than in our schools. Starting Monday, Charlotte-Mecklenburg schools will be mask optional. We're going to speak to a teacher coming up in just a few minutes, get his perspective. But first, joining us today, CMS board member Rhona Cheek. Rhonda, thanks for coming on. We appreciate it.
Great to be here.
All right, so what do you expect Monday to be like for CMS schools?
Well, I think we're going to see a lot of smiles, the smiles we haven't been able to see for some time. And I say that with the full understanding that many people are still very concerned and feel that they should wear masks. And I respect that choice if they make that choice to wear them. I think we're going to see a mix of masks and unmasked staff and children.
You push for masks optional to happen sooner than this. Do you think this is way too late?
You know, there was no reason for us not to go mask optional when the county health department, the county lifted their mandate. We probably, in my mind, we should have gone ahead and just started this Monday.
And what is your message to teachers, some of whom have said that they don't want this mask mandate lifted? What do you say to them?
You know, I think we have been talking for 2 years about follow the data, follow the national experts. I'm not one, but our local health department says it is safe to lift the mandate. The CDC now is lifting mandates. Across the nation is lifting mandates. And I do respect and empathize with those that still have concerns. Potentially, maybe they have someone in their home or themselves that is immunocompromised or at high risk. So it's completely fine for me if for them to be wearing a mask. That's how they're going to keep themselves safe. But it's time to also respect the rights of those that are not at high risk and can safely work without masks on.
How did this become so political in the last 2 years? It's unlike anything I've ever seen. It's, of course, not just CMS. I mean, this is a thing happening across the country. How did it get to this point?
You know, I love social media. It's a lot of fun, but I do think that Dr. Facebook and, Nurse Instagram have shared a lot of information with people that may not be accurate. And so I think there's just been so much information out there, some accurate, some grossly inaccurate, that have really gotten people kind of whipped up, would be the best way to describe it. I think that people, and your health and your own health journey is a very emotional topic, and the health of your children, the safety of your children, the academic success of your children. I was told by former House of Representatives Sue Myrick, when she was retiring, she told me that the hardest job that she could ever imagine is being on the school board or being involved in schools, because parents are very emotional about what happens with their children, and rightly so.
What do you think we have learned over the last 2 years?
Well, gosh, I think one thing we've learned is that adaptability is the key, that we have to be open and in tune with new information when you're dealing with something that is unfolding in front of you and around you. You have to really be open and adaptable. What we thought we knew about COVID, coronavirus 19 and all those things in March and April of 2020 is vastly different than what we know now. And I think that this has taught us that science moves quickly and we need to move quickly with it.
Let's say you're the boss. What you say goes. It's just that simple. It's that easy. What would you have done differently in the last 2 years?
I think I would have taken the pause. I think we needed that pause when we, shut things down briefly. But I think I would have opened things back up pretty quickly. There's a lot of misinformation about what really has helped and what hasn't helped, flattening the curve, not flattening the curve. It's the biggest where we should have done something immediately with people in assisted living, communal living situations, because that's where the high death rates really hit so hard and done a better job of and I speak medically here, but identification of the high risk factors. And then those people should have been the ones to make the choice to stay home, mask up and all that. And the rest of us, I think, probably could have safely gone about most of our life.
We should say that you are a registered nurse, maybe not a public health
not a public
expert,
health expert, but I am
still,
a registered nurse.
But you are a registered nurse, so more educated on these topics than many of us. Going forward, masks or not, there's going to be a reckoning that we have in the months and years to come about the learning losses. And the state came out with a report over the last few days about just how bad they are. What are we as a community? What are we going to, as a district, what are we as a state going to do to tackle that?
As a nation, as a universe, really, it's not just it's everywhere. It's tragic. So many students did not thrive and actually did terribly in remote learning. There's a small segment that's going to pipe up and say it was great for my child. It's just not great for the majority. My own son that went away to college did not do well with remote college. So I think what we've got to do is look at ways, what are proven methods to get kids caught up. We can't just take a slow time here. We have to get back to where we were. I'm hearing from a lot of people that kids are starting to settle in and we feel like we're going to improve a lot in the second semester, but it's going to take hard work by everybody, including the kids, the families, and the staff, to get kids back where they were. And that means community support too, because kids, when they're outside of school, need to be in learning rich environments as well.
Hypothetical worst case scenario here. I know I spoke to Raynard Washington a couple weeks ago. He says we should expect new variants. We should expect new developments in this. What is your message to parents in the community? Let's say another variant rears its ugly head. What is your firm stance going forward?
I truly think that those that are at high risk need to protect themselves if they choose to wear a mask. I think that's great. I really do not see, based on the language that I'm seeing coming out from people, that we would go into a mask mandate again. Although anything's possible. I would just tell people to be vigilant, to do the things you need to do to improve your health and reduce your risk factors. Start exercising more, get your blood pressure under control, get your diabetes under control. All those things do contribute, and we as a public need to improve our public health. That would reduce our risk to these kind of issues.
Rhona Cheek joining us now from a parking lot as she has a patient waiting for us inside. We do not want to keep that patient waiting any longer. Rhonda, thanks for coming on. We appreciate it.
Thank you. I'm heading in right now. Bye-bye.
All right. More Flashpoint after this.